What are the most important things a woman can do to try and not have her breast cancer return?
I would like to think that my patients and women have some power over this, and they probably do to some degree. Again, taking good care of yourself and loving yourself is important, and making sure that you eat well with a nutrient-dense diet, and that you are doing some exercise, that you're getting adequate sleep to restore yourself, are probably the three most important things that you can do. Um, Sleep should not be underestimated, because when we don't sleep, our body is under stress. Even if we don't feel, stressed out and twitchy, our internal organs are under stress. And we know that cortisol levels are higher when people don't sleep, and that can add to, laying on body fat, even when you're dieting and exercising and doing everything right. So fitness, good diet, and sleep are things that are all within a woman's control. I would also say that being educated about what some of the signs and symptoms of a breast cancer might be would also be important. And so we would want a woman to be aware of her breast and her surgical site, and still check that site, even if she had a mastectomy, for whether there was any irregularity or any funny lump happening or grittiness, or is the implant moving, or just like, signs and symptoms of breast cancer. But so to continue to have an awareness of the surgical site, even if the breast is absent, because women can have recurrences in the treated breast, or even on the flat chest wall, if the breast is removed. And that for some women is surprising, that that it could come back on the skin where their breast had been. The second is to have an awareness of where breast cancer could grow inside you, and what some of those signs and symptoms might be. So breast cancer, depending on the type that you have, but for general purposes, it likes to come back in bone. Bone is one of the most common sites, lung, and liver and belly, around the bowels. Not in the bowels, but maybe just around the bowels. And so I try to counsel women to have a very low bar for anything that just doesn't seem right. But yet not make them crazy ladies thinking that every week there's something wrong. So, if a woman were to notice that her breathing just wasn't right, and that this was evolving, changing, we're looking for change. Not, that I run up the stairs and wow, I'm short of breath, because everyone can run up the stairs and be short of breath, and that's normal. But if you've always been fine walking a half a mile, and then one day you find, wow, I'm really feeling short of breath after just minimal exertion, that's a change. And that's something that you would want to report to your primary care physician or medical oncologist or other care provider. Bone pain is really tricky, because as we age, we all get bone pain, and we get arthritic pain in our fingers and our wrists and our knees, and our hips. But if there's any real change in the frequency of the pain or the pattern of the pain, and most importantly, if the pain that you've had all the time fails to go away, with things that always made it go away, that would be a reason to maybe seek help at your primary care or medical oncologist. Recurrences in the liver and the belly are subtle, but it might be that you're filled up faster. You used to be able to eat your whole plate of food, and now you just really don't want to eat at all. Or if you're losing weight without trying. If you're changing your diet around and had been a carbohydrate queen, and then make a conscious effort to switch to more protein, fresh fruits and vegetables, of course you're going to lose weight and still be eating ample food. But if you've made no dietary changes and just start dropping weight for no reason, that would be something that you should report to your doctor. And sometimes if swallowing or just like feeling that the food just doesn't move and that you're filled up, this is something you would want to report. And in breast cancer, the big problem for physicians taking care of women with breast cancer and for the women is that there is no one blood test or scan or x-ray right now that we can do on a consistent basis to reassure women that they are okay. So the bar is low, and if there's a complaint, we like to have women come in, we talk to them, assess the complaint, see if there's anything obvious on their exam, and then probably do some blood work or imaging, whatever is appropriate, to make sure that everything is okay. And most of the time, everything is okay. But this is part of being a breast cancer survivor and even a breast cancer victor is, I think there's a lot of little worries all along the way, and it's hard to tell your body aging sometimes from a cancer recurrence. Another thing is that the Cancer Society has somewhat coined the phrase in breast cancer, 10 years and you're cured. And I think that is, it's a good place to start. But now that we know that breast cancer is not one consistent entity in every woman, that triple negative breast cancer has the capacity to behave quite differently than an estrogen-driven breast cancer. And, women should talk to their oncologists about, when is the peak worry period for me for my cancer to come back? So for women who have more angry and aggressive cancers, 10 years and you're cured is appropriate. Actually, for triple negative breast cancer, 5 years and you're cured is probably appropriate. But for some women who have the estrogen-driven cancer, those cancers can recur very, very late. They can recur 10, 15, 20. I have one woman, 28 years after her initial diagnosis, her breast cancer recurred, and it recurred with fluid around her heart. And the issue for these women is it's 28 years since their breast cancer, and their primary care physician and nurse practitioner and everyone has somewhat forgotten about the fact that this lady had a breast cancer years and years ago. So I always tell women, don't forget you've had breast cancer, and if something odd is happening to you years and years later, you need to remind your care provider that it did happen, and that maybe that is still a possibility. A lot of time breast cancer survivors will survive their providers, and in this day and age, it's not uncommon for a woman to maybe have 2 or 3 different primary care doctors because people move around so much, and maybe need a little prompting or reminders. Just being empowered with information about your cancer and type of cancer and what your surveillance should be after cancer is something that's very much in control of the woman. And now there is a major effort going forward in breast cancer management that when women do complete treatment, that they are given what's called a treatment summary or a survivorship care plan, which they have and their primary care physician will have, which reports all of the distinct features of their cancer, the treatment they got, any anticipated toxicities of that treatment and how to care for that going forward in life, what their surveillance plan might look like, and most importantly, what some symptoms of recurrence might be and how to manage that. And I think this type of effort of empowering women as well as their primary care physicians with these types of summaries really helps guide survivorship care over the years.